So now guys, we shall be focusing on the topic genital herpes. We shall be discussing about genital herpes. Now in this genital herpes, all of you know what is the most common cause of genital herpes? The most common cause of genital herpes would be Herpes Simplex Virus 2. Herpes Simplex Virus 2 causes genital herpes. Now, characteristic thing which you need to know in this is that in these patients there will be very painful vesicles. There will be very painful vesicles or pustules. Okay, there will be very painful vesicles or pustules, right? Where are they formed? They are formed on the labia, right, on the lips of the vagina. They are formed on the penis, as well as they are formed on the buttocks. So these are the very painful vesicles that are formed in these three different locations. Okay. Now, normally these are painful vesicles and pustules are the primary infection which is happening. But HSV-2, normally where does it sleep? Where does it reside? Yeah. For example, let us say this is the spinal cord. Okay. Now here in this spinal cord over here, you have got this one is called as a dorsal root. This is called as a ventral root. Okay, dorsal root and the ventral root. Now dorsal root has got a ganglion like this. This is called as a dorsal root ganglion. What is this? This is called as dorsal root ganglion. Now obviously dorsal roots and the ventral roots, they join together to form a spinal nerve. What is this? This is called as your spinal nerve. Spinal nerve. So dorsal roots of S2, S3 and S4. Dorsal roots of S2, S3 and S4. Exactly in these dorsal roots the HSV-2 resides. HSV-2 resides. For example, if you are reactivating them, if you are reactivating this HSV-2 in the dorsal root ganglion of S2, S3, S4, this would lead to a condition of genital herpes. This would lead to a condition of genital herpes. So what would be the treatment here? The treatment would be patient has to receive antiviral drugs like oral acyclovir for 7 days. Right? So you can give to the patient oral acyclovir. So oral acyclovir is given for around 7 to 10 days. Okay. Apart from oral acyclovir, you can also give valacyclovir. Okay. So this is all you need to know regarding the important points which you need to know regarding the genital herpes. Thank you so much for watching my video. Goodbye.